5,500 women in Wales will receive a letter similar to this one within the next few days. It's one of the most serious public health alerts ever seen here. At least 2 patients contracted the disease from the healthcare worker who treated women at Caerphilly Miners District Hospital for almost 20 years. The unnamed worker also spent short periods of time at the old East Glamorgan Hospital in Pontypridd and at Wrexham Maelor Hospital in North Wales. Health officials in England, Scotland and Northern Ireland are also contacting former patients who may have come into contact with the infected person.
This is an incident also that's wider than Wales. The healthcare worker had worked in England, in Scotland, in Northern Ireland, and work has gone on over the past few months to actually coordinate the effort between the 4 administrations in the UK so that all 4 of them can do the same thing for patients who may be at risk.
Sometimes hepatitis C can have no obvious symptoms, but other times they can include flu-like symptoms, tiredness and depression. Although 20% of people can get rid of the disease without treatment, in some cases it can lead to serious liver damage. You can catch the virus by coming into contact with the blood of an infected person, and health workers have been screened since 2007. And in the vast majority of cases, treatment is successful.
Over the last decade, there's been a lot of new and effective drugs developed for the disease, and that's why it's important to know that you've got it. 20 years ago, actually, there was little that could be done, so knowing you had the disease didn't help. But now, because of these very effective treatment that actually can get rid of the chronic disease in about 80% of people, or up to 80% of people who are treated, it's worthwhile knowing you've got it because there's something that can be done about it.
Health officials insist that patients who receive this letter shouldn't be overly alarmed. But with 2 cases confirmed, they're urging women that could be at risk to get in touch so they can be offered tests, advice and support.